Today's topic of discussion is an interesting one, a hot one, and it's infertility in men. Good afternoon, Dr. Walker. Thank you so much for joining us inside Body Talk.
Hi, afternoon, Dean. Pleasure to be here.
All right. Now, not the thing that many men want to discuss, or many,
Absolutely not.
you know, for any stretch of the imagination. But
Right.
what exactly is infertility in men?
Well, infertility really describes the inability or the reduced capacity to conceive via natural means. Essentially, it is something which can affect up to 30% of couples. And for all couples seeking help with respect to infertility, probably around 30 to 50% of the time, it is male factor infertility, which is the underlying cause. So it's way more common than people expect. The expectation majority of the time is that it is the woman who is the sole reason, for infertility issues. What we know is that 1 out of every 3 couples, or 1/3 of the time, it's actually the male who is the predominating factor for the infertility.
Wow. So it's not as far as many as you mentioned a
Yeah,
moment ago.
absolutely not. Absolutely not.
Wow. Now, how? All right. So it's very common, obviously, in Jamaica. So the statistic: 1 in 3rd of all the situations is
Right.
Jamaican statistic, or is that worldwide?
That is worldwide. So that is by international standards, and that is something which I believe can be extrapolated
Jamaica.
to Jamaica itself.
Interesting. Interesting. Now, this is normally found out when an individual desires or when a couple desires to have a child. But are there other um, traits that individuals could look for that could indicate that there's perhaps infertility?
Well, absolutely. So majority of the time is, as you said, couples may be, having difficulty getting pregnant, seek medical attention. Most often, it's the woman who would often present. Women in general, because women often would be, women get pregnant because of menstruation, because of the use of contraceptives. Women tend to be the first ones to seek medical attention,
Mhm.
and therefore tend to have better doctor-patient relationships. So it's either the male when they present alone, or they present as a part of a couple with issues or difficulties becoming pregnant. Now, there are certain physical characteristics or traits which men may have, which may indicate that there is some underlying genetic problem which can be contributing to infertility. For example, there's a particular syndrome which we refer to as Klinefelter syndrome, where men tend to have Klinefelter. It's a particular
Clientele.
Yeah, it's a particular genetic syndrome
Mm.
where males tend to have very small testes, a small scrotum, tend to be very tall, tend to lack facial hair or evidence of secondary sexual characteristics simply because of a decreased circulation of testosterone. So
Mm.
these are things which may indicate that this person may have some underlying issues, fertility, secondary to decreased testosterone as a result of that genetic defect.
Oh, okay. So
Most of the times, that's very rare. So
that's
most
very
of the
real.
time,
Okay.
right, very rare. So most of the times, it's the couple who presents difficulty getting pregnant, and usually after a year of unprotected intercourse, couples are encouraged to seek medical attention to find out if there's any issues contributing to that difficulty.
Interesting. Now, perhaps you would have mentioned this later on, but there's a lot of the talk that sometimes the foods we're eating have impact on our, reproductive health as men.
Right, right, right.
Is that scientifically validated, or is that all
Not really, not really, not really. So it's less about the precise foods that we're eating. So you may have somebody selling a particular juice on the corner, and they say, "Yeah, man, drink this. It good for your vitality." Everybody, everybody has heard that one already. The truth is, there are certain modifiable factors or environmental factors which can contribute to male infertility. So, cigarette smoking,
Mm.
in particular, marijuana smoking, recreational drug use, all those things are known to actually reduce the sperm count. excessive weights and elevated BMI, or individuals who exercise too much. So everything is all about moderation, and
Moderation.
each end of the spectrum has its own individual risk. So for those individuals who don't exercise and have an elevated BMI, there's an increased risk of reduced sperm count. Those individuals who exercise excessively tend to produce a lot more stress hormones called cortisol, and cortisol actually decreases circulating testosterone. Right, so it's both end of the spectrum. In addition to, as I mentioned, the marijuana use, cigarette smoking, but
Mhm.
also the scrotum actually hangs outside of the body for a reason, and that is because it needs to be, the testes or the circulating sperm needs to be at a lower body temperature than our core body temperature.
Okay.
So for individuals who, when they're using the laptop, they have the laptop placed in the lap. And I mean, it's called a laptop,
Yeah.
but the
It
heat
could
that it
be.
generates, right, the heat that it generates can cause excessive warming of the scrotum, and that can affect the sperm count. For
Wow.
those individuals who like to go in hot tubs for extended period of time,
Mm.
those things can affect the sperm count. For
Wow.
those individuals who wear excessively tight undergarments or excessively tight pants or jeans, those things can contribute to increased warmth around the scrotum and can affect the sperm count. So there are those environmental slash modifiable risk factors, which we know
All right. So
can
those are
affect
the
the sperm
factors
count.
that can affect it. Are there
Right.
any factors that can boost the sperm count?
Well, certainly, as I mentioned, one of the reasons for low sperm count is a low testosterone level. So
Mm-hmm.
certainly what we do know is that those individuals who are treated with testosterone, those are things which can increase the sperm count.
Mm.
So supplemented with testosterone, we know that those individuals who have, for example, erectile dysfunction as a result of low testosterone, those individuals who have a reduced sperm count as a result of low testosterone, administration of testosterone can often reverse that issue.
Interesting, interesting, interesting. Now, when an individual is diagnosed with that problem, the
Right.
number one medical treatment would be to prescribe some form of testosterone, correct?
Well, it depends.
It
So,
depends.
right, the first step has to be, what is the underlying cause for the low testosterone?
Okay.
Because it could be something which is, as I mentioned before, which is genetic.
Genetic, yeah.
And right, and simply prescribing testosterone may not address the underlying problem. So there are certainly reasons for an individual to have a low testosterone level. It's all about identifying what that underlying reason is and then addressing that problem. So it's not a one size fits all approach,
Interesting.
particularly when you're dealing with male infertility. There is a process where you have to sit down, speak to the patient, do a history, examine the patient, because there are certain things that you may unearth during that history and examination session.
Very interesting. Quick, a question that comes to my mind is this. Now, if an individual, if after all the examinations and nothing can be done on their part to boost testosterone, what are the options as it relates to, conceiving with
Well,
their
again, it depends. So let's say, for example, we're talking about somebody with an extremely low sperm count.
Yeah.
It's not a matter of this person is unable to conceive, right? It's really a matter now of whether this person requires what we call assisted reproductive technologies.
Oh,
So the
okay.
sperm count is low, but this person may still be able to have a relationship where they can get the person pregnant. It just may have to require the use of what we refer to as assisted reproductive technologies. So there are certain methods where we can extract the sperm and actually inject it into an egg and fertilize it.
Oh,
Simply because the actual number of sperm may be too small for normal conception, meaning for the
okay.
partner to ejaculate on the inside and for that sperm to now travel all the way to the egg. So the chances that there's going to be one sperm that is going to reach where it's supposed to reach and fertilize that egg is low. What we do is we kind of provide a shortcut, right?
Oh,
So we introduce the sperm directly into the egg. So there are certain technologies which we can use to help those couples, and partners who have extremely low sperm counts.
What can a woman do to comfort, encourage a male partner struggling with infertility? Because not many men want to hear that.
Definitely.
We would go in depression because of that.
Definitely, 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 and I mean that is a serious issue. We talk a lot about the medical aspect of it, but there is also the emotional and the social
Hmm.
aspect of it as well. And the same is true when we're talking about the converse in terms of women who are having
Women as well,
difficulty
yeah.
getting pregnant. We'll always ask the partners to be present for the visit so that we can explain certain things to them in a way that they can understand. And by understanding, they're able to be a little bit more empathetic and sympathetic when they're having discussions with their partner. So the first thing I always do is encourage the partners to be present at the time, right?
Okay.
Because these are things that you're dealing with a couple, and it doesn't just affect one; it affects both, and it can have significant effects on the relationship itself. So it's always important to explain what is happening, explain why it's happening, explain a particular approach that we're going to take, so that it's not a matter of, okay, this is the problem and there's nothing we can do about it. It's, this is the problem, this is why it's happening, this is how we're going to approach it, and this is the end goal that we hope to reach.
Mm.
And I think when we do it that way, we'll have a much happier couple and a much better outcome overall.
Okay. Okay. I can imagine. All right. Thank you so much, Dr. Walker, for joining us. Certainly enlightening, especially where it speaks to where you spoke to the laptop, and the increased heat in
Definitely.
the scrotum. I think many men will take heed where that is concerned, and
I hope so.
wow, I would have never thought that that could have had any impact whatsoever.
Yeah,
But
man,
thank you for the
definitely.
information, and all the very best. Keep on doing what you're doing.
Yeah, man, same to you. Thanks for having me.
Yeah, man. Very, 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 very interesting. Very interesting. Always great talking with Dr. Leo Walker.